Assalamu alaikum. Thank you very much. It's a privilege to come back to the old stage. I see some of my very good old friends with whom I have worked in 2009 and 2014-15. It's a great pleasure to see that PPD has come to this stage. I am sure some of you would recall the struggle that we had in 2009 to keep the PPD, to get the land for the PPD, to start the building the building, then getting the help from China, getting the help from India, and the government of Bangladesh was very kind enough with our persuasion that we could build the PPD building, and it has come to this stage. I'd like to thank everybody who has worked all along to come to PPD to this stage, especially my fellow members, countries, and their representatives. And I know the PCC from every country who have worked very hard, including my country, to come to this stage. I'm very pleased to see my Health Minister, Deputy Health Minister, Dr. Ruhal Haque, with whom I have worked since 1980. The day I came back from UK, I know her since then, and she is a Health Minister at this moment, and I'm so pleased to see her on this stage as a chief guest. Thank you very much. Thank you all the others who are present here, Dr. Tarek, who have presented the declaration, and all the presenters that I have seen that have worked hard, very sincerely, to go through the programs and work very hard to come to this stage at the end of the program. I will again say that it's a very gracious for the board members of the PPD to invite me on this stage. Thank you, sir. I'll just say thank you all. Dr. Ruhal Haque, Dr. Mahmoud Sheikh General, Dr. from Kenya, Dr. Mohammed Dongi, President, Director General, National Board of Family and Population from the Government of Tunisia, Dr. Siddhar, International Consultant from India, Oliver Jivaku, Officer in charge of PPD, and all the board members and the workers from here that have worked very hard. Thank you very much. Excellencies, ladies and gentlemen, my words will fail to express my gratitude, as I said before, that you have been so gracious to come to invite me in this occasion. Good afternoon. You have worked very hard yesterday and today, and I have seen the discussion. It's wonderful to see that we are struggling and finding out about money. That matters. But that is always the problem. And I am very pleased to see the innovative presentation and innovative discussion that has come through. I'm sure that we will be working very hard for that. As I said, I am honored to be here with you in this important closing session of 21st International Inter-Ministerial Conference of Dhaka, Bangladesh. I have enjoyed my involvement with PPD as a host country board member since 2009 to 2013. You may recall my working relationship with former two chairs of the PPD, especially Dr. Li Bin from China, who helped us very much in that stage where we were struggling, and also the vice chairman, who is the vice chairperson of the Chinese Population and Political Consultative Conference now. I must thank my fellow colleague at that time from India, the Health Minister, Mr. Ghulam Nabi Azad, the former Minister of Health and Family Welfare of India, who also supported us very strongly with all the others to bring the PPD at that time. The PPD is a global center of excellence for the South-South cooperation in population and development. They have also supported PPD to be self-sustained intergovernmental organization. The ICPD, held in 1994 in Cairo, marked a provisional movement of global development of efforts by recognizing the population and development are extremely linked. During the ICPD 1994, PPD was established to achieve the implementation of the ICPD program of action. The roles of PPD as a platform for sharing experiences, expertise, resources among member states in the global south, and we never been more crucial than today. We should therefore continue to foster cooperation, South-South and triangulation participation that we have been discussed just now also, partnership and acknowledge exchange to accelerate achievements of the ICPD agenda and sustainable development goals. We must also achieve and ensure that no one be left behind, which is the declaration that we know very well, especially in the post-ICPD, post-COVID-19 recovery efforts, that we must not leave anyone behind. We need to improve our healthcare services for people of all sectors. We wish PPD members to continue with and share their best practices for improving the health system so that the people of our member countries will get benefits from the country's experiences. Some of our member countries are equipped with adequate health care commodities, family planning commodities, essential drugs and technologies. We expect that these countries will support other countries for solutions to their problems. In conclusion, I must say, by working together, sharing innovative solutions and supporting one another, we can make significant stride towards a world where every individual can lead life dignified, free from discrimination and with the opportunity to fulfill their participation. I must thank our government, especially our Honorable Prime Minister, who is very much interested, and I must remember that our government is always very much interested to support the PPD. As you see, the Honorable Health Minister is here. I'm sure our Senior Minister was here in the previous occasions. So we have been all through been very supportive, and hopefully we can work together to solve the problems that we have been discussing. Thank you all. Thank you very much. Thank you. I must thank UNFPA, WHO, and all other agencies that have supported PPD very strongly throughout these years, and I hope that you will continue to help us to develop and guide us so that we can develop in future. Thank you. Jai Bangla, Jai Bangabandhu. Assalamu alaikum.